So, do you know the effects of steroid use on the body and performance? Steroids have been proven to increase strength by up to 38% and possibly even more in women. They increase fat loss and allow athletes to train harder and recover more quickly. Another, quote, positive effect of steroid use in athletes is a determined mindset. Determination is absolutely important when it comes to meeting goals and improving performance, but is it really determination, or could the motivator be anger fueling competitiveness? Some negative effects of steroids are acne, high blood pressure, heart problems, psychiatric disorders, possibly no effect on performance, and even suspension or loss of career. Effects like heart problems and high blood pressure could negatively impact performance by causing extensive health problems that could slow down or even put an athlete out of the game. Another important negative effect of steroid use is aggression, which people commonly disguise as determination for the game. For women, an additional effect of steroid use is irregular menstrual cycles or the absence of a menstrual cycle. For men, a couple additional effects of steroid use are a low sperm count and prostate cancer. This diagram shows that steroid use is the number one reason for athlete suspension or dismissal. According to the Mitchell report, the use of steroids does correlate with athletic performance at a 12% increase. We know steroids correlate with an increase in strength and the amount of oxygen sent to the muscles. This results in a performance improvement, which leads to an increase in number of wins. An increase in a number of wins leads to a larger fan base. Who wouldn't like those outcomes? Well, steroid use can result in hair loss, heart problems, bad acne, high blood pressure, reproductive complications, the list goes on. They can also cause psychological disorders, including loss of control of emotions, insomnia, eating disorders, depression, anxiety, etc. Life is always a butterfly effect. Because of all these side effects, long-term performance will be negatively impacted. Some other long-term effects can be loss of family, loss of friends, and possibly loss of your career. It could also mean a life filled with scandal and the building of a bad reputation as an athlete and a professional. Substance abuse prevention programs vary a bit from league to league. In the NFL, they do regular drug testing, and if a player tests positive, they begin in the program. The sample is retested to ensure accuracy, and the medical exam is completed so that any physical conditions that may cause a natural increase in chemicals in the body that could have resulted in the positive test is ruled out. Then a psychological evaluation is completed. Next, legal and professional ramifications are then decided through an appeals process. The NBA has a program called the Life Extension Institute, which is a recovery and counseling program that works with athletes who come forward with their substance abuse problems. The MLB has a policy that requires players who test positive for substance abuse to submit a medical evaluation. Medical personnel then decides if the recovery program is necessary. An agreement is made between the player and medical personnel. Players can choose inpatient or outpatient treatment. If a player refuses to follow this process or commits to treatment and then tests positive again, they will be suspended or dismissed from the team. So, are steroids worth the risk?